Okay, this is a arthritis and rheumatism study from 2007, and it's growth hormone perturbations and fibromyalgia a review. Okay, so by 2007, 13 years ago, they have caught on to the fact that there's an association with the pituitary and fibromyalgia. And it was quite a large study. 26 studies enrolled 2,006 fibromyalgia patients. Overall, low levels of IGF-1 were found in the subgroup of subjects. So some of them anyway. Growth hormone stim testing often revealed a suboptimal response. And that's the diagnoses, which did not always correlate with IGF-1 levels. No consistent defects in pituitary functions were found. Well, if they're not making growth hormone, that is a defect. Now, I don't know if they're getting into the typical causes like a brain tumor, injury, Sheehan's disease, which is, there's a number of causes, but I will continue. Of the 3 randomized placebo control studies, only 9 months of daily injectable growth hormone treatment reduced fibromyalgia symptoms and normalized IGF-1. Hooray! A treatment! But their conclusion is these studies suggest that pituitary function is normal in fibromyalgia. Okay, they're contradicting themselves. And that reported changes in the IGF-1 axis, I'm abbreviating, are most likely hypothalamic in origin. How do they know that? And I'm going to give a little story time here. When I was getting worked up for growth hormone insufficiency, I asked the doctor, why aren't you checking my hypothalamic hormones? And he said it's not necessary in the diagnostic process. And I don't know, I'll understand all the details. It's way above my pay grade, but he knew, my doctor. He said that hypothalamic hormones are reserved in cases in children. So something else is going on structurally or whatever. But there you have it. This is, again, why are they denying their own results? Okay, I better move on. Again, we have a 12-year-old study. This was done in 2007, and it's titled Growth Hormone as Concomitant Treatment in Severe Fibromyalgia Associated with Low IGF-1 Serum Levels, a pilot study. Okay, they've really caught on now. At the end of the study, the growth hormone group showed a 60% reduction in the mean number of tender points compared to the control group. These people had a prompt response to growth hormone administration, with most patients showing improvement within the first months in most of the outcomes. It was well tolerated, and no patients discontinued the study due to adverse reaction. Conclusion, The present findings indicate the advantage of adding a daily growth hormone dose to the standard therapy in a subset of severe fibromyalgia patients with low IGF-1 levels. Ding, ding, ding. They really have caught on. And people, please consider, if you have fibromyalgia, consider asking your doctor to test your IGF-1. And if it's low, then find yourself a good endo. I'll continue. Okay, 2007 was a very busy year. Another study. and it's titled, Is Further Evaluation for Growth Hormone Deficiency Necessary in Fibromyalgia Patients with Low Serum IGF-1? And they studied 77 fibromyalgia patients. They said 13 patients, 17%, failed the arginine stim test. They do use, I think they still may use arginine. GHRH is not available in the United States, but it'd be a comparable to a clonidine stem test or glucagon stem test, ITT test. Okay, I transgress. 13 patients failed the arginine test. Okay, but I'm adding it up to 19, unless I'm missing something. Okay, further evaluation with pituitary imaging revealed normal pituitaries in 7. And, a little bit of a story time. I do have a history of adrenal Cushing's, which is not really, particular. It's not in the literature that I would come up with growth hormone insufficiency, but I did. I had a normal brain imaging. I did not have whiplash or any kind of injury or a tumor, so, okay, I transgress a bit. But the point being, I had a normal pituitary image, and that was 7 in this study. Coincident microadenoma. 4 people had a pituitary microadenoma. That's a big deal. Empty sella, I'm not going to get into the definition of that, but it is a cause of growth hormone insufficiency. And 1 had that. A pituitary cyst, 1, and revealed medical history such as a previous head injury, 4 people. Sheehan syndrome, 1. Whiplash, 1. That adds up to 19, so I don't know what the 13 means. Let me speak briefly on Sheehan syndrome. And this can happen to women, at the time of childbirth. And your pituitary is on hyperdrive during the pregnancy, birth, and birth of the baby. All the labor and delivery. Okay, this can disrupt the blood flow to the pituitary and damage it. It could have a very quick onset, and that would be observable if the mama can't produce milk. They would start looking at that right away. But it can be created by a slow onset of hypopituitarism. So if you had an onset of fibromyalgia at the time of giving birth to a child, please get your IGF-1 checked. I will continue with the study. In contrast, the remaining 64 patients, and that number would have to be wrong too, that responded to the growth hormone stim test demonstrated higher peak growth hormone compared to the controls. And, inquiring minds want to know, did they have follow-up with an endocrinologist? I don't know if there's an association with this, but is it possible they could have Cushing's? They're talking about BMI match controls, but what did they weigh? Were they overweight? I just end up with a lot of questions. Okay, and in conclusion, the increased growth hormone response rates in the stim test in the majority of fibromyalgia patients with low serum IGF-1 levels further support the hypotheses of dysregulated growth hormone IGF-1 axis in the physiological of fibromyalgia, and my phone's